Okay, we're going to start off just to say hello and welcome to everyone. Thanks so much for joining us for this Boots Island event. We have a great panel for you of experts, so I hope it's going to be a really useful and informative session. Just a few things to let you know: the event is being recorded, and if you'd like to post on social media, please use the hashtag Boots Island and tag boots.island on Facebook and Instagram. And please do ask questions or share comments as we go along. There's a chat box down at the bottom of your screen and it's confidential, so feel free to ask everything you want to know. So to go on, as we've seen in the media over the last year, the whole subject of fertility is becoming discussed more openly, which is a great thing. And Boots Island want to highlight key concerns and offer advice and support to people who are on their fertility journey. So last month, they commissioned a survey to find out more about people's key issues and experiences. So that's what we're going to be looking at today. We're going to be talking through the results of that survey with our panel. So just to introduce our panelists, we have Dr. Catherine Reardon, who is medical doctor at the Menopause Hub and Bray Women's Health Centre. We have Dr. Soka O'Brien, who is a Spire Fellow in Fertility at the National Maternity Hospital and the Merion Fertility Clinic. We have Sheila Shoga, a broadcaster and presenter. And we have Kiva Macaulay, who is Director of Pharmacy for Boots Island. So let's start with the first research finding. According to the research that Boots has conducted, 57% of people surveyed, aged between 25 and 45, are concerned about their fertility. So Dr. O'Brien, can I come to you on this and ask you to explain what the main concerns are and why?
So I suppose fertility concerns in general can be quite broad reaching, but ultimately what people are expressing is a concern that they might not be able to achieve their family creation goals and desires, whether that be a number of children or children at all. And I think whenever there's an awareness push on something, it's really positive, and I do welcome the opportunity to raise awareness about fertility challenges. But ironically, that can sometimes lead to anxiety around a topic as well, because people are thinking about it more, they're focusing on it more. And there has been other evidence published that showed when you increased education about fertility, that it led to a perception of fertility threat or infertility threat amongst young adolescents in a large Welsh study that was published this year. I think also, if we look what's been happening over the last couple of years, there's been a lot of changes in our lives. And for some people, their social circumstances might have changed or might not have changed in the way they desire. So either they've had a relationship breakdown or they've not been able to meet their ideal partner because of limitations on social interaction. And that's led to people really reassessing, I think, their priorities and a lot more self-reflection on what their priorities and their goals are in life. And certainly we've seen that evidenced in a larger proportion of women coming to us looking for fertility assessments that are single, and particularly an increase in things like fertility preservation and egg freezing, which has doubled over the last year or so exponentially.
Right, okay. And especially with this being the week that it is, as you mentioned earlier, it being Mother's Day, that also puts more focus onto the whole subject.
Yeah, for sure. And I think, it can be quite a challenging time for people who are going through their own fertility struggles, that obviously there's a lot of focus on Mother's Day this week, and they feel that they're not able to be part of that conversation. So we just want to acknowledge that it's a difficult time for people who may be linked into the webinar at the moment. Yeah,
absolutely. So let's go on to the second research finding. Boots research showed that for 13% of respondents, not being able to have children is a key concern, especially among those aged 25 to 35. So Dr. Reardon, can you shed some light on these findings and perhaps help to put people's minds at ease?
Yeah, I suppose that the first thing to say is it's great that people are worried under the age of 35, because if you have, as a woman, if you've a regular menstrual cycle and everything seems to be normal, your chance of pregnancy is fantastic under 35. But one thing that people don't seem to realize is when you're even in your 20s, when your eggs are at their best quality, you only have a 20% chance of getting pregnant each time you try. So people aren't getting pregnant at the drop of a hat. And I think sometimes people panic if they don't get pregnant first or second time they try. There is no test you can do to show your chance of getting pregnant. People sometimes misunderstand. There's a test, the AMH test, which is a test of what's called ovarian reserve, and they get a score on that and they think it determines their chance of getting pregnant. It tells you nothing about your chance of getting pregnant. at that particular time. The single biggest factor determining your chance of pregnancy is your age, unfortunately, and there's no way to sugarcoat it.
Yeah.
We're still the same animals we were way back when we lived in caves. And you started having your periods at, 12, 13, you were matched up with a man and off you went, and you started churning out babies. When you got to 35, 40, you were kind of done and dusted.
Yeah.
Whereas now at 13, you're going to school, you want to do your leaving cert, you might go to college, do a medical degree for 5 or 6 years, you're looking for Mr. Right, you don't want to just take the man that's thrown at you. Mr. Right can take a long time to find if there is such a person. We want our careers, we want the house, and sometimes women just wait too long till the nest is perfect and they've missed that window of fertility because like I say, in your 20s, 1 in 4 or 5 eggs is good enough to become a baby. But once you get into your late 30s, early 40s, we're down into, your chance of pregnancy goes from 20% a month to maybe 5% a month. So your chance, it's going to take you longer to get pregnant. Your risk of miscarriage goes up as you get older. So your chance of actually having a baby starts to nosedive when you get into your late 30s. So you need to be waking up in your early 30s, especially if you want more than one baby.
Yeah.
And the other huge factor that people don't seem to take into account is when you look at a couple who are struggling to get pregnant, to make it really oversimple, a third of the time, it's going to be entirely a factor on the woman's side. A third of the time, it'll be entirely a male factor. And in the other third, there will be at least part male. So in 50% of couples, if they're struggling, you need to look at the male side. And I see so many times people want to come for fertility discussion with me, and the woman turns up on her own and she's prepared to subject herself to all sorts of invasive tests, even laparoscopies, and nobody's looked for sperm. And the men are sitting at home thinking it's nothing to do with them. And the other thing is, I think if it does turn out to be a male factor, as a man, it must be really difficult, and we don't really give them any respect for that. I mean, it's a huge blow for a man to be told your sperm aren't good enough, you may not be able to father a child. Yeah. They go to fertility clinic and they're told, oh, you've got enough sperm, we'll get them, we'll inject them into the eggs, you're grand, and they're kind of sidelined. And I think men deserve a lot more education around their role, but also support when it turns out that they're the one with the problem.
Yeah, absolutely. That's a really good point. And another finding from the survey was that a significant number, that's 12%, are concerned about not being able to afford fertility treatments, should they need them. So I'd like to bring in Kiva McCauley, Director of Pharmacy at Boots Island, on this one. Can you tell us, Kiva, your thoughts on this particular finding and just some options of supports that are available to people?
Yeah, so I think, look, the first thing to say is it's a very, very understandable worry. And I think for me, with any fertility concerns or fertility issues, knowledge is power. So I think the first thing I would suggest is that the most important step is understanding what the issues are for you as an individual, so that any treatment that you do take is actually targeted appropriately. And when you understand this, then I would suggest you do your research to understand the likely success of any treatment that, can then help you to make the decision around whether it's the right thing for you to focus on going forward. I think in terms of if you're female, understanding, I suppose, your own cycle, your own hormone levels and your fluctuations throughout your cycle is really, really important. And there are some fairly inexpensive tools to help you do that. So whether that's tracking your basal body temperature or whether that's monitoring your ovulation with ovulation kits, those different, I suppose, tools can really, really help you in the earlier stages. But many GPs and certainly all the fertility clinics will be able to support you with testing and monitoring of hormones through your cycle, and they can support you with any other investigations that are necessary. I think for me, the key thing probably to call out is when it comes to the particular protocol that's appropriate for you, it may involve, monitoring your hormones, it may involve medicines, and it may actually involve other procedures. And I think the important thing to call out from a pharmacy point of view is that in addition to paying for those procedures, you will also end up inevitably having to pay for those medicines. And some of those medicines will be covered under certain schemes. I think you'll probably be familiar with the drug payment scheme and the high-tech schemes. So certainly speak to your pharmacist about that, and we can try and help make sure that you're actually in the right scheme, and that if there is a way that we can support payment for those medicines, then we absolutely will. I think the other thing to call out is that you can claim your tax back on your annual medicine spend in your pharmacy. And again, we can support you by providing your Med1 report that you can submit along with your tax return. And also, more and more we're hearing of health insurance policies also covering some prescription costs. So it's a good idea actually to check with your insurer and shop around in different policies. But I think with this, you know, the protocol will vary from person to person, and it will be very individual depending on that. So I think some of the things I've highlighted can hopefully help point you in the right direction. But as I said, from a medical point of view, from a medicines return, speak to your pharmacist and can certainly help you with that.
Yeah, that's great. Thanks, Kiva. And timing is also an issue. So 11% of respondents to the survey are concerned that they might not find out that they have fertility issues until it's too late. So Dr. O'Brien, can you talk to us about some of the options available to couples?
Yeah, and again, it's very key to highlight. So a lot of us spend a lot of our time when we're in our teenage years and our kind of 20s, sometimes into our 30s when we're not ready for whatever reason, trying to avoid pregnancy. And then you get to the stage where you actively want to be pregnant, and every month that you get a period, somebody described it very well to me, like the unwanted period that comes. When it comes to guidelines of when somebody should actively seek out investigation, we would say if you're under 36 and you've been trying to conceive concertedly for a year or longer and you haven't conceived spontaneously, then you should seek further investigation. If you're 36 or older, or if you have a known fertility impacting condition like endometriosis or polycystic ovarian disease, or a chronic condition that might impact your fertility, like inflammatory bowel disease, or you've had surgeries on your abdomen in the past, we would say 6 months in those kind of scenarios. So the age for straightforward trying to conceive would be 36 and above for 6 months, but any other conditions would be any age at all. Certainly, I'd say there's no time too early to be seeking discussion about fertility. But what we would say is that now we're delighted that there are some public services that are a bit more streamlined and available for people. And the fertility hubs have been getting up and running. So there's one in the Coombe, there's one in the Rotunda. In Holles Street, we have one that covers the Ireland East Hospital Group referral pathway, and Cork also has a fertility hub. And there will be 2 others getting set up between Galway and the Midlands. And they are taking referrals and will be able to provide workup, assessment and diagnosis for couples. And in appropriate circumstances, will be able to provide medical and surgical treatment for the appropriate cases. Unfortunately, there are always going to be a percentage of people that these aren't suitable for, or they might not fall into, I suppose, inclusion criteria for management within these hubs. And there are always going to be people that require assisted reproductive technology like IVF. And it's maddening and very frustrating to me as a doctor in women's health, and also a woman, that we don't have public funding provision for IVF as yet. Certainly we've no timeline on it. But just to highlight, as already been mentioned, some people might be lucky enough to have insurance policies that will cover some of the treatment. There's the tax rebates and the DPS drug payment cover. But realistically, if you're paying out of pocket, you're looking at a huge spend. And you could be looking at an average of 6,000 spend, or anything between 4,000 and 7,000 euro per cycle, depending on the type of treatment that you need. And that doesn't include your investigations and your workup. So there is public help available, and we would advise people to speak to their GP and get referral appropriately, and get referral sooner rather than later. Don't wait for that 2 years if you've already been trying to conceive for a period of time.
Right. Okay. Absolutely. I mean, I think, you know, it's obviously good news that people are starting to be more open about the whole subject. And from the survey, there was 72% believe that people are starting to be more open about fertility. And interestingly, more than half of those, 57%, believe that the woman should shoulder most of the responsibility for fertility and family planning. And do get your questions into us for the in the Q&A box, just so that we can, you know, we'll get to questions in a little while. But first I want to go to Sheila, as someone who's spoken very openly about your experiences. Could you tell us your thoughts on these findings, that people are starting to be more open?
I mean, I find that really refreshing that people are. I also understand that, you know, for a lot of people, it's a no-go area. I mean, for me, I'm a very open person, so it helps me to kind of talk about the ups and downs and all the rest. But I know that it's not everybody's thing, and we have to be mindful and respectful that everybody's experience of fertility is their own. And, you know, before we got into this today, we did a kind of we had a chat amongst ourselves. And I think it is a good point to reflect that actually even participating in a discussion about fertility like this can sometimes be quite overwhelming if you're just dipping your toe into the world of fertility, or if you are already on that path. And, you know, as has already been said, every month that passes, maybe there's that level of disappointment, and we go again, you pick yourself up and you go again. So yeah, I mean, look, it's great to hear that people are open. I'm a bit surprised and a little disappointed that it was 50% saying that it's kind of down to the woman, because we know that that is not true.
Yeah.
That is not true. As Dr. Reardon just said there, it takes two. And I mean, if we're looking at a conventional couple who decide to have a baby, you know, it's, you know, it is the woman and the man, let's be honest. So, and I think, as already has been said as well, information is power. And I'm a huge believer in that. For me personally, I suppose I'm big into getting bloods taken and finding out, you know, where I'm at with different things. And I've learned a little along the way. Nothing like the experts here and, you know, the expertise they're bringing to the table. But even simple things like AMH, when I got my first AMH levels taken, they weren't that high. They were pretty low. And I remember feeling like really devastated, thinking I might not have a baby. And then I had them taken again and they were higher. And I went, wait a second, I thought AMH only went down. And then we've learned in recent times that AMH levels fluctuate depending on, you know, what foods you're eating, what supplements you're taking, what your stress levels are. So we're learning more and more and more all the time about fertility. For me, I suppose the fact of it is that actually getting pregnant was not an issue for us, but having had 2 miscarriages, I needed to look at it, because it really knocked the stuffing out of me. I was 37, conceiving our little boy, Cahill, who's now 4. I was 38 having him, and I'm 43 next month, and I have a 4-month-old baby girl. Our family is complete. I feel incredibly lucky, but I'd also like to think that, you know, if we decided to have another, that I might have a bit of time left. I think it can be kind of scary to think that, you know, past the age of 35, that, you know, as has been said, your fertility kind of falls off a cliff. And while that might be true in some cases, I know plenty of people who do have very healthy babies late into the 30s, into their 40s. So it is possible. And I think fear is a very strong and powerful force. And sometimes it can be very debilitating to think of all the things that go wrong. I think being empowered, having the information at hand, doing all you can, preparing as best you can. And then there's a huge element of having to let go and watch nature do its thing. And if you're destined to have a baby, well, you've given yourself the best possible chance. But I think physically, mentally and emotionally, all those things have to be taken into consideration. I was a big believer in ticking all the boxes beforehand. Was I taking the right supplements? What was my diet like? You know, was I limiting the caffeine, chilling out in the booze? Was I getting the exercise in, doing all those things? But also, what was my mindset like? Well, how was I feeling about it? What is my relationship with my partner like? Am I laughing? Am I having fun? Or is sex now just a means to get pregnant? You know, where's the fun in that? So I think we can't lose sight of why we're with our partners either. There's so many different elements. It's so huge, isn't it? It is. And I really do feel for people. I mean, I made a documentary on the topic of miscarriage. So I've met so many people who have had so many ups and downs when it comes to wanting to have their own family. And I'm just fully aware that it's not a one size fits all. It's incredibly emotive for people. And at the end of the day, those who have tuned into this webinar today are hungry for information and they're on their own path. So it can be a tricky one, but I would say not to lose hope. And, you know, as I said, I was 42 having my second, a perfectly healthy baby girl. It's absolutely possible for that to happen to people too. And, you know, really don't lose hope.
Yeah, well, that's really nice advice. And it sort of ties in with the final research finding from Boots Island, which was that 14% of people said they'd experienced stress and anxiety around fertility, and 13% found that it had affected their mental health, and 6% even reported the end of a relationship as a result. So, I mean, do you have any advice, Sheila, on people going through difficulty and just sort of starting out on that?
I know a lot of people who have had huge relationship difficulties when it comes to now we you know, we've had the time together, just the two of us, and now we want to have our family. And then perhaps it takes a lot longer than they thought, or perhaps it's not happening at all. But the pressure that puts on your relationship, because we all know what it's like, you know, you kind of go in 2-week windows, don't you? You get your period, and the next thing you're building up to ovulation day, and you're trying to track your cycle or whatever it might be. But you know, I would be a big believer in not getting too clinical about sex. At the end of the day, that's how a baby is made. And have fun. Don't get too, you know, structured that we must have sex now, because actually that's the biggest turn off, I think, for a guy, and probably for both of you. And just to relax into it more and more. Communication is hugely important. If you're worried, say that to your partner. You know, he can't read your mind, or she can't read your mind. You know, you got to be able to communicate with each other and say, look, I'm finding this really hard. And maybe getting outside help is a good thing. I got outside help. I had some amazing sessions with a wonderful fertility coach called Helena Tubridy, and she was amazing. And there's plenty of them out there. And because I felt I didn't realize I was actually hanging on to trauma from the miscarriages. And through sessions with her and talking it through, I realized I was able to let that go, because the fear was so ingrained in me now. I said, okay, you know, is it going to result in a miscarriage again? And you really do need to work on managing those fears. So I really believe that communication is vital when it comes to starting a family. And at the end of the day, you know, remember why you're with this person. You love them, you know, and, you know, if you want to have a family together, you must be able to tell each other how you're feeling. And they probably are feeling just as much as you know?
Yeah, absolutely. And Dr. Reardon, can I come to you on that point as well, just around the anxiety and things that people feel?
Yeah, I mean, I think it's something that a lot of couples don't actually realize. Certainly when I was working in IVF, I was very conscious of the fact that by the time a couple came to sit in front of me, they'd already been trying for maybe 2 years and nothing was happening, and they were already stressed up to the eyeballs. Now they're maybe going to go down the IVF route and not understand what's happening. It's costing them a fortune. They're sacrificing, they're taking out loans, hugely stressful. And yet at the same time, they're looking around thinking everyone else is taking this on board, sucking it up and getting on with it, and they think they should do the same. And maybe one of the couple's more invested in it than the other, and there are all sorts of stresses. I think there must come a point that every time you step outside your front door, it looks like everyone else is pregnant, or they're pushing a pram, and your friends and your sisters are getting pregnant, and you want to be supportive of them. But all happy as you are for them, your next period comes and you're not pregnant, or you've had another miscarriage. And I don't think people realize how traumatizing that can be. And certainly I work with a psychologist who would offer a lot of support to people, and I have yet to meet anyone who hasn't come away thinking that was the best thing I ever did, because you just learn how to cope with the stresses. You learn the language for protecting yourself in situations. So yeah, I think it's huge. People need to stop thinking they should just pull up their socks and get on with it.
Yeah, that's so true. And Kiva Macaulay, just to say, have you got anything to add on that?
Yeah, I think I wholeheartedly agree with what Catherine has just said. I think stress definitely can have a big impact on how we're feeling emotionally, physically and mentally, and also how we behave. And it's really, as Catherine has said, learning how to manage that. And I think reaching out for that help and that support is really, really important. I think, you know, that the research has shown us, and events like this are so important in enabling us to break the taboo and have conversations about this issue that's so important and impacts on so many of us. But I also think the other point that was made earlier is actually it can cause stress even thinking that you have to have this conversation. So I think the other thing I would reassure anybody that, you know, as Boots, we have a network of pharmacies across the country. We have pharmacists there who you can talk to confidentially. So some people might be very, very comfortable having that conversation with their friends, their families, and so on and so forth. But for others, that might be hard. And we are there. We can help you, we can support you, and we can signpost you to appropriate help as well. So I suppose really just to add that in as well.
Yeah, that's great. All right, thanks, Kiva. Okay, so we can open up to some questions now, and do keep sending questions in on the chat box there if you'd like to. But just to start with, Dr. O'Brien, how long should you wait until seeing a healthcare professional about fertility queries?
Yeah, I suppose I've briefly touched on this. I think it's probably never too early. But from a dedicated timeline perspective of when somebody should be seeking further investigation, particularly if you're under 36 and you've been trying to conceive with your other half for a kind of concerted effort for a year or longer, you should seek further investigation by referral through your GP. Or if you are 36 or older, or have a known fertility impacting condition from a male or female perspective, we would say 6 months. And I suppose there has to be some kind of arbitrary cutoff. And obviously, Sheila had mentioned about we talk about the fertility declining drastically after 35, but I suppose it's not so much that your fertility switches off, it's that your fertility potential is reducing, and the odds are stacked against you slightly more. So we don't want people waiting inordinate amounts of times. And we do find, sadly, that either through a lack of help-seeking behaviour, or a lack of awareness or lack of knowledge of who to go to, or perhaps maybe people haven't been directed appropriately in their community, that people are waiting probably a little bit longer than we might like. And as Dr. Reardon said, they might have already been trying to conceive for 2 years before they come to you, and then they're waiting on an appointment, and then there's investigations. And if they require treatment, there's a lead in. So they're already ready to start a family. And again, there's a delay, and every month that goes by, there's a delay, and there's an awareness of not being pregnant. And we would often find people say, well, you're talking to us about timeline and time being sensitive, but then I have to wait for X, Y, or Z. So it's a frustrating time for people. I suppose it's important that people have the appointment or the consult with the right place at the right time in the right manner. And everybody is so different that can vary as to what's appropriate for them.
Yeah, sure. Okay. And one for Dr. Reardon, what can I do to plan for a positive fertility journey?
Ooh. I suppose it depends where you're starting. If you're in your early 30s up to the age 35, 36, you just need to look at your lifestyle. If your cycle is regular as a female, and if there's no reason on the male side to think you might have a problem, you look at your diet and your lifestyle. But I think too often people think they can eat and drink what they like and sit around taking no exercise, and if they go to Boots and buy a fertility supplement, that'll compensate. It won't. There is no bottle of pills that will compensate for a lousy diet and a lousy lifestyle. So if you really want to get pregnant, you need to not be drinking excessively. Men should not, and women, but particularly men, should not be smoking. Recreational drugs can have an impact. And your diet, I mean, healthy diet is lots of fruit and veg. It's much better to get your nutrients that way than out of a bottle, because the balance is right. We don't know. There's so many studies done on supplements, but nobody really knows exactly which ones we should be taking in what combination or what dose. But if you get it in your food, it's all calculated. Nature has figured it out for you. So I think that's a huge thing. And then, as we said before, if you're stressed, find some way of working around that. I mean, there was one patient I had one time that really brought it home to me. She'd been trying and trying and trying. This was through IVF, and nothing was happening. And I said, look, I think actually maybe you should just take a break because you're really stressed. Just take a couple of months off. It's not going to really. And she said, Catherine, you just don't get it. When I wake up in the middle of the night to go to the toilet, the first thought that comes into my head is, I'm not pregnant.
Oh, God.
I mean, that's got to be crippling.
Brutal.
So looking after yourself, but healthy lifestyle is huge.
Right. Okay. It's very practical. And going back to Sheila, just to say, how did you stay so positive on your journey?
I wasn't always positive. I did have my moments, and certainly going through the 2 miscarriages, particularly the second one, absolutely floored me and really took a lot out of me. And I know people say, you might be fertile after having a miscarriage, but the last thing on my mind was wanting to try again after a loss. So I gave myself time, and I think it was the right thing to do. I had my therapy. I took time out for me, and I suppose as well, life experience. I mean, as I said, nearly 43. I had cancer at 32. I've had lots of ups and downs and ins and outs, as we all have. None of us have a perfect life, because it doesn't exist. But I think when you hit challenges, it builds resilience. and you
Yeah.
realize that this was a crap time in my life, but I got through it, so I'm going to get through this.
Yeah.
So I think recognizing what you have, I'm a huge believer in the practice of gratitude. And I think I'm also a believer in, you know, what we're putting out, what our energy, what our vibe is basically.
Yeah.
So as Dr. Reardon was explaining there about that woman getting up in the middle of the night to go to the loo thinking, I'm not pregnant. Unfortunately, if you have that mindset, you're reaffirming that you're not pregnant. So I'm a big believer in working on things like visualizations, manifestation, whatever keeps you going.
Yeah.
Visualizing that it is going to happen for me, staying positive as much as you can. I'm a bit of a mixed bag. I'm a pragmatist in one way and very logical thinking, but I'm also a dreamer, and I like to dream and think. And I always deep down felt that we were going to have 2 kids. There were certainly times when I wondered, was it going to happen? But it did. And here she is. And I'm very, very lucky. And I know how lucky I am. I'm not saying it to be smug. I'm saying it for people to realize that if it happened to me, it can happen to you too. It can happen to anyone. Because, you know, I didn't meet my partner till later in life. We were in our mid-30s. I wasn't in a position before then to have babies because I hadn't met the right match for me. So, and I wondered, had I missed the boat before I ever got pregnant? I'd made peace with the fact that perhaps not having a family is my life's plan. Maybe I'm not destined to be a mother. And weirdly, with that mindset, it was very freeing because it opened me up to the possibility, well, maybe it will happen. So I think you need to keep an open mind. An open mind is really, really important. And just minding yourself and being grateful for what you do have, because I think that really is important.
Yeah, absolutely. And we have a question here. Someone who is 40 years old and has had 2 miscarriages in the last year and is asking, what investigations should I consider? So maybe we'll go to Dr. O'Brien on that.
Yeah, that's really tough. I'm sorry for that person having gone through that. I think pregnancy loss at any stage is valid, and we should recognise that, as Sheila is saying, even if it's a very early pregnancy or biochemical pregnancy, once people have that positive test, they start visualising what that child might be and the life they might have, and then it's snatched away from them. I think it's a challenging one to kind of talk about from a clinic perspective. So we would say, we talk about the definition of recurrent miscarriage, and that's 3 miscarriages in a row. And it's awful to think that you might have to go through that a 3rd time before you'd have formal referral and investigation, especially when you're 40 and you're very conscious of time, as we talk about a lot in fertility. Certainly, if people choose, they can opt for investigations after 2 miscarriages, through the GP or through, I suppose I don't like, kind of talking about private versus public, but you can have these tests if you choose. And we would talk about tests for thrombophilia screen, trying to identify conditions that might be pro-inflammatory, lupus anticoagulant screens. And they're fairly easy to have performed. They take a while for the results to come back. And then the question is, when you have that information, what do you do with that? Because you would need further referral onwards to discuss the results. So sometimes maybe seeking a referral to your gynae clinic, your local gynae clinic, to have a discussion. Or if you wanted to seek a discussion with somebody like Dr. Reardon about that in her own practice, that would also be advisable.
Right, okay. All right, thanks for that. And someone's asked here, is there an ideal AMH for each age group?
Dr. Reardon's talked about the AMH already. So the AMH is a good test. I'll pass this over to you, Dr. Reardon, if you want to take that one over.
Yeah, the AMH is kind of a tricky one to explain, really. So girls are born with all the eggs they're going to have. You have about 1 or 2 million when you're born, and they just disappear over time. When you get to puberty, you've only 300,000 or 400,000 left, and you lose hundreds or thousands each month. What your AMH is telling you is how many eggs you've got left in the basket. But as long as you're still releasing an egg each month, you have the same chance of getting pregnant as anyone else your age. All your AMH is telling you is that maybe if it's low for your age, you're not going to have that window of opportunity for as old as somebody whose AMH is higher. You may run out of eggs younger. But right now, your chance is the same as anyone else your age. And we don't know, you had your AMH done today. Could be different when we test it next year. Is it static? Is it falling? Is it falling quickly? You just don't know. So it's kind of, I don't like the way people get stuck in this AMH as though it's telling them they can't get pregnant.
And also it goes up and down.
Yeah, it can fluctuate.
Mine was low and then it was higher.
It
And then
can
it was a
also
little
be,
bit,
you know,
low.
it doesn't peak until you're in your kind of mid-20s anyway.
Yeah.
And then it can fluctuate depending on if you've had oral contraceptive pill recently or if you've breastfed recently, it can be suppressed. And I suppose from a fertility perspective, we use it in a fertility perspective to decide what dose of drugs somebody might be on in a stimulation cycle, maybe predict what their response might be. And there's a broad range of what's normal, you know, and what's average for a certain age group. So Dr. Reardon's hit the nail on the head. It's not going to tell you what's your potential to get pregnant. It just gives you an idea of what your fertility potential is going forward.
Okay.
Once you've got a regular cycle, whether it be anywhere between 22 and 35 days long, if you're regularly getting a period, you can predict your ovulation about 14 days before your period. Start to have intercourse a few days in advance of that, and a few days afterwards. Every other day is perfect, not too much, not too little. Try and make it romantic, as Sheila said. Maybe have a dinner in the house, maybe go for a weekend away if you can, and just kind of put the love back into the thing, for want of a better way to describe it.
Yeah, absolutely. And someone else is asking here, I'm on thyroid medication. Would that or other medications affect fertility?
Well, I suppose it depends on the thyroid medication they're on, but certainly we would want thyroid conditions to be treated appropriately, and for somebody's thyroid to be stable. From a fertility perspective, we're quite aggressive actually with the thyroid, and we screen thyroid hormone levels as part of the workup, because there's the concept of subclinical hypothyroid disease, where your thyroid hormones might be slightly abnormal, but they're not causing you an impact on your thyroid function. And it would be an independent risk factor for pregnancy loss in the first 12 weeks. So we would treat thyroid disorders at a lower threshold than might be in the general population or in the community.
Right. Okay. Thanks for that. And another question, are there any support groups available for people struggling with fertility?
There's the NISIG, which is the National Infertility Support and Information Group. I think you find them through Facebook, at least.
Right.
Yeah,
they actually have an Instagram page as well. I can post the link to that later on if you want to repost it. They're an excellent support service for people in all different couple scenarios as well.
Yeah. Okay. Perfect. And Kiva, is there anything else you want to add from a pharmacy point of view, just on this subject?
No, I think, as has already been discussed, when it comes to the likes of vitamins and supplements and all those other supports, they're not magic bullets. And certainly the lifestyle, the diet, and the whole holistic approach actually to your well-being is the important piece. But there may be times actually when there are products that are recommended for you from your doctor or your specialist. And I think what I would remind people as well is that supplements, just like medicines, can interact with other drugs. So it's really important when you're having that conversation to be open and transparent about anything that you are actually taking, and also speak to your pharmacist about that, because they can help guide and support you through, if you have been recommended particular supplements, what those might be.
Okay, perfect. All right, we've got one question.
And it only takes one egg at the end of the day, let's be honest. So, you know,
and a
I
sperm.
think, and
just
one.
one.
Well, correct, absolutely, just the one. But I mean, and I don't mean to oversimplify it, you know, but I think sometimes, for me anyway, initially, you know, the whole AMH, and it can just seem like a minefield of information coming at you. But, you know, we know as well that AMH is only a snapshot. It's not anything to do with the quality of your eggs. And all you can do is give it your best shot and prepare as best you can. And if you're ticking all these boxes, if you can kind of write out a list of what am I doing, all that has already been said by you guys. Am I doing all this stuff? Do I need to make changes? And then really, it is just surrendering to it, letting go. But I do think education, if I knew now what I know now, if I had this information in my 20s, wow, it would have blown my mind. So I think the earlier we can educate women and men about their bodies, about fertility, the better.
Yeah,
I would see quite a lot of couples come in and they're kind of panicking a little bit too early. They've maybe been trying for between 6 and 12 months and they're getting worried. And I sit down and I give them all the information and I say, look, if you're not pregnant in another few months, then we'll do this test, that test, the other test. And the next thing, a month or two later, they're pregnant. In a message say we're pregnant. and they haven't done any of the tests. It's just they know now, they understand the timing, they know that they're not unusual, and they relax and it happens.
Yeah. So that whole stress of just relaxing and worrying about it all the time.
And as Sheila said, just letting go of it.
Yeah. Easier said than done, but it's so important. Yeah.
I mean, not everybody needs, you know, fertility treatment in the sense of IVF. Some people just need a little bit more signposting about, you know, how to change things a little bit. And, you know, we would say that by the end of the first year, about 80% of couples will conceive naturally. And by the end of the second year, up to 90% of all couples will have conceived on their own. So I think it's difficult when a couple have made that decision to try to conceive. In certain cultures, there's more inward pressure on a couple to have children earlier, and children are a huge cultural factor for a lot of people. And that you're almost trying to hold people back and say, look, you know, this is fine, we have time, this is okay, you could do this on your own, you might not necessarily need any additional services. So it's trying to find that balance, I think, for people.
Okay, yeah, perfect. Look, I think we'll wrap up there, but a big thank you to all our brilliant panel. It's been so interesting. And thanks to everyone for joining today. And just to remind you of the social media handle at boots.island and #BootsIsland. And finally, to tell you that your discount code to use on the Boots Island website, boots.ie. So it's fertility in caps, all in caps. And you can use this code to save 15% off selected women's health products. So thanks very much, everyone, for joining.
Thank you.
And,
thanks for the event.
Hope it's been useful. All right.
Thank you.
Okay.
Thanks so much.